Talk 365 TV's Talking Wellness is brought to you by Brain Rehab Clinic.
Hey everybody, welcome back. I am Holly Love and that is Todd Summers.
Hi everybody.
And we have a Talking Wellness series that we have been doing on brain function with Dr. Hatch down at the Brain Rehab Clinic. And I got to go down this time and we are talking about functional neurology and the aging brain, which is such a hot topic.
Yeah. Well, it's been interesting for me. I'm 56. You start to notice along the way, as you age, the differences. And for me, it's really kind of come in the last 6 years.
Okay.
I'll get up to go do something in another room. I'll get in that room and forget why I got up.
Which I think that happens to me,
Yeah.
and it doesn't really matter any age, but it happens, right?
Right. But it kind of scares me a little bit because I start to think, well, geez, am I?
Is this how it's going to be?
Yeah. Is this gonna? Am I gonna forget everything from now on? But so this Dr. Hatch, he's an amazing guy.
So it was really fun to talk about the aging brain because functional neurology is a field that is just changing every day, and Dr. Hatch and the Brain Rehab Clinic has their finger on the pulse of it. They are on top of whatever the next is, the latest technology, the latest equipment, how to get brain function happening in places that it was dead no matter what age you are. So if you've had a brain injury, they can get your brain firing and wiring in places that using different technologies, different testing to know if it's working and what's working, because a lot of it has to do with the fact that if your brain isn't functioning right, your medication isn't going to work. It's like having a broken arm and then wondering why you can't throw something right.
Yeah.
It's the same thing if you've been in therapy for a long time and it seems to not be working. If you have spells with vertigo and you're aging and you've maybe had a stroke and you just are really struggling, you've done all the rehab, they can rehab the brain and it won't reconnect, but from neuroplasticity testing, the brain is so plastic, it will route around the dead part and reconnect in another way.
That's amazing.
You can ultimately be back to one. And for seniors too that are struggling and think that this is just all that you have and this is how life will be, kind of like what you were thinking, that's not the case. So you're gonna love this segment. Here's Dr. Hatch in our Talking Wellness series on brain function.
Talk 365 TV's Talking Wellness is brought to you by Brain Rehab Clinic with wellness team expert Dr. John Hatch.
Hey everybody, I'm Holly Love and welcome to our Talking Wellness series on brain function. Today I am back at the Brain Rehab Clinic with Dr. Hatch. Hi, how are you?
Thank you for having me.
I always love coming down here and talking functional neurology with you. And today we are going to be talking specifically about functional neurology and the aging brain, which, let's be honest, there is so much conversation about how to up-level your life through up-leveling your brain. There's hacks every day on YouTube, a new person who has a new idea, and ways to be able to turn back the clock. I mean, this is some seriously hot topics here.
Yeah. Yep.
And what I love about you is you don't just have hacks, you have the testing, you have the research, you have all the skills and tools to do it. So let's talk the aging brain advancements. What are you most excited about and what is new for them and us looking forward for aging?
Yeah, just the simplicity of how plastic a brain is, how much it can change and shift has been the most exciting thing for me to study aging brains, whether it's an Alzheimer's patient or a dementia patient or someone whose balance has gotten really bad, or a lot of times we think, well, once we lost it, it's gone forever. Well, it's not. The pathways are still there. Some of them have neurodegeneration, but we can still make new connections, and the diagnostic tools today can tell us even better where the breakdown is versus just seeing it on an MRI. That means that 70% of the degeneration has already occurred if you're seeing anything on an MRI. Well, that's not good odds. I don't want to wait till I see it there. I want to see it right away. The moment it starts happening and start changing it, improve the brain and get the quality of life. I mean, I want to be 90, 80 years old, still jiving, still smiling, still having joy in life, not feeling like, oh no, I'm getting old, I'm just gonna stop.
Yeah, well, I think that's the conversation that everybody is wanting to have and the solutions that they want to hear, that there are solutions, number one, and that there are ways to be able to do this. I think from following people like Gary Vee, more and more people are saying, don't just go away in your 60s. What are you thinking? You have this computer, you have this wealth of knowledge, like go contribute in the world and get out there. You have so much to bring to the table, and trust me, if a 6-year-old can learn to do Snapchat, so can you.
Yes.
Don't let this stuff intimidate you, but a lot of the intimidation comes from brain dysfunction, and it's all stuff you treat. So let's talk about your diagnostic equipment, because I think that is key to helping someone understand why this is so unique and so different, and why you get the results you get.
Yes, like one of the new tests that we've been working on is just looking at timing in temporal lobes and coordination. That's high executive function of the brain. So if we're seeing early onsets of Alzheimer's or dementia, we're gonna see it in their timing sequence. And it's amazing that I've had concert pianists in here that are like, I should be able to do this perfect. Well, their brain hasn't been working as well, so they can't hit that executive function again. And then we create plans in rehab to change that aspect of the brain, and then we can post-check and see how much it's improved. Because a lot of times people say, well, you can't teach an old dog new tricks. Yes, you can. It takes longer to learn the trick, but you can learn the trick. And then we also have another diagnostic tool called CogniView, and it's one of the FDA-registered companies that really show if your brain is impaired. They actually have a guideline. It has over 100 tests, so you never do the same test. You can't memorize it. So you can see where are you at cognitively, and then through therapy and rehab, we can check post. We had a patient in last week that literally scored subnormal cognitive function, and at the end of the week, she was already at high executive cognitive function just by doing different brain pathways. And that was a new game changer for this individual, and we love that. I mean, that's what it's about. Another piece of equipment we've been just using lately is the laser with photobiomodulation. The research out there, the tech that's out there is incredible, and it helps improve actual tissue. So it gets functionality to a tissue that might be dead because it hasn't been activated. So just going in and activating it like we used to didn't really work. The whole, if you don't use it, you lose it. Well, that doesn't always work if the system itself isn't working. So using laser therapy and then the brain therapy can connect things that weren't being able to connect before.
Wow. Well, and talk gyrostem, because that's another huge,
yes.
you're like one of a few in the United States clinics that have the gyrostem, and it is such a key piece if somebody has vertigo, PTSD, a lot of issues that seniors and everybody face, and they think it's just a life sentence.
Oh yeah, and the amazing thing is the vestibular system, your inner ear, the balance system, it taps out at 40 years old. That's why most athletes don't progress past 40 years old. Once you hit 40, you can only get as good as that vestibular balance system was. The rest of the league and the career all go up, but you hit 40 and it just plateaus. So as we get older, we start to see our balance get worse. We stop using it and it declines even faster. So what we can do is we can put them in a gyrostem and actually do these different exercises where a gyrostem can rehab the pathway, activate the canals, activate the system, and reconnect it and get the brain to adapt correctly, and then you have a whole new outcome. It's incredible.
Yeah.
The changes we've seen with people, the way they walk, their posture. People always talk about posture. Just because you're old, you do not have to be like this.
No.
That is a brain function.
Well, you've said before, the brain doesn't care about the rest of your body. It's the ultimate survival tool in the whole system, and it overrides everything. So if it needs to be hunched over, bent in an arm like this to feel good and feel balanced because it's so damaged, that's how you're gonna be, and it has nothing to do with your actual
Shoulders back.
muscles or your bones, or that you're, low in calcium. It's like, it's amazing because I've seen it through my treatment program where things have changed literally just like that. So let's talk about the types of things people are coming in here that you're able to alleviate symptoms of through these different treatments, through the diagnostics, especially for seniors.
Yeah, especially memory. I mean, a lot of the seniors, they're okay giving up their shoulder rotation or their shoulder mobility if they can recall where they're at, where they're going. Well, especially when they walk into a room and you're like, why did I walk in here? That's not necessarily a cognitive memory thing, it's actually a spatial memory thing. So it's actually a parietal lobe imbalance with the cerebellum that regulates where we are in space. And so a lot of our balance stuff, you can know, hey, my balance isn't doing well when you walk into a room and you don't remember why you went in there. It's actually not necessarily a memory response. And so these different things of knowing where I am in space, knowing why I walked in the room, where did I put my keys, these are things that can stay active. You can recall your grandson's name. You can recall why you went this place or where you went. And as a young person, I want to prevent it so I can have the highest quality of brain until the day we leave this earth. But more importantly, for my grandparents or my parents, I don't want to worry about them. They're getting in the car, they're driving, that's scary. But if I got their brain working, they can drive all they want. And a lot of people, they come in and say, I've lost my license because of this, or I'm really scared. Because once you hit that, I'm not remembering, the emotional side of this to the elderly is so dramatic. And it makes them feel like, I've lost all hope and this is the beginning of the end. And they just shut down. Instead of being excited, it creates even almost sometimes a bigger emotional problem than when they were young, dealing with all the stress of life.
Well, let's talk about mental health and anxiety and depression. We have an incredible online training you can get on his website where he dives deep into explaining functional neurology's approach to that. So I highly recommend you check that out, because there are things that you can do to simply hack that. You see results for people who are in the depths of depression, like you're saying, at that place where they're just like, they think it's over, they have tried everything, and they come back from doing treatment and testing with you.
And get some change, and then it always takes time. It always takes 3 to 5 months to change that brain, but they can start to see symptoms change. They can start to see it because the tests show it. And then that gives them hope. And then as long as they stay consistent, it will change.
I want to say, like, you know, what exactly do people need to be suffering? And I know the conversation and the answer to the question is, it doesn't matter what you're suffering with, because if your brain is not functioning correctly, all of the symptoms that you're feeling will be justified. And when you sit down with this guy, he will sit up there with the whole test in front of you and explain to you everything you're feeling that every other doctor you've been to has told you you're crazy, and they don't really know what to do with you.
Well, and the thing about memory that really is the trigger in this aging brain, because when memory goes, they don't want to do anything. There's 4 areas of the brain that are involved in memory. So you can't treat one. What if the memory problem is over here? So you have to be really careful of creating a plan for someone in their elderly years. What is going to maximize their potential? And so we're taking supplements, we're taking pills, we're taking everything to stay young, but what are we doing for our actual brain function? That's where I feel this big missing link, this missing hole that can take a brain to another level, so the supplement can actually work, so the medication can actually work, like we've spoken many times before. But get the brain to work so it's alive and functioning, and if you use it, you don't lose it. And even in the elderly, we start to feel more anxiety, and it's specifically because the cerebellum starts to degenerate. And when the cerebellum starts to dysfunction, we have less sleep, we're more irritable, right? Grandpa's short temper, so to speak, right? And these things happen because of the brain, not because that's who they are.
Yeah, can we bring it back?
Usually, if the pathways are still alive and still viable, you can make great changes for them.
So what age should you start looking into brain rehabilitation?
From an aging brain standpoint, I love the age 40 because that's the vestibular balance. I mean, for me, I started 8 years ago because I want to keep my brain as young as I possibly can. But 50 is the ideal window to say, hey, let's keep this brain going. But I have seen patients in their 90s that still want to improve their brain. You can change it at any time. The sooner you change it, the better the outcome. Because you can't regrow a part of the brain that's not there. It's gone, it's gone. But you can make new connections so you can actually feel like you're 10 years younger. Your brain probably isn't, but the functionality of life is. And that's the joy in brain rehabilitation.
That is amazing. And the thing with what you do here, again, you have the testing and the diagnostic equipment that you can see week to week, month to month, the progress, and you can tell people this will work because you have the proof to show that it does.
Yep. And if it isn't going to work, we're going to see it as well.
And you're going to know.
It's not like, okay, we got to do this for the next 3 months and hope it's going to work. By the end of a week, I can know if I'm going to help a brain or not help a brain.
If you are someone who is aging, if you are someone who is suffering with a condition that you feel like you've tried everything, or if you're a person who just wants to up-level their life this year, get into Brain Rehab Clinic and do the testing, and they will figure out exactly what you need to be better, faster, stronger in every aspect of your life. Dr. Hatch, thank you so much.
You're welcome.
I love chatting brain with you. Be sure and join us again because we will be talking more through this series about the brain. You can always find more information on his website, including online trainings and initial consultations where you can pretty much learn everything you want to know before you come in here or while you're coming in here, and then get in here and obviously take the opportunity to utilize all of the knowledge and skill that he brings to the table, as well as the equipment and this incredible facility at Brain Rehab Clinic. So thank you again for your time.
Appreciate it.
Don't go anywhere. We'll be right back on Talk 365 TV right after this.